First, I would like to ask all of your permission to use this video for educational purpose and on internet.
Sure.
What happened 10 months before the surgery?
My riding lawnmower was stuck on a little log, and I couldn't get it off, so I thought I would pull a 600-pound lawnmower, which is really stupid. But I tried, pulled really, really hard, and I heard a pop.
Okay.
And then I went to my knees.
And you felt it right away?
Mm-hmm.
So, and then you went to hospital, I'm assuming?
I didn't go right to the hospital. I went
But eventually?
a couple days later, yep.
Yeah?
To the ER.
I went to the ER, yeah.
And that you had a broken bone?
Yeah, yeah.
And it wasn't a questionable little broken bone. It was a serious broken bone. You have a compression fracture, and part of the bone was moving the wrong way even, and so on and so forth.
And there were shards in there.
Yeah,
you know.
yeah. And obviously you have osteoporosis, meaning that nothing unusual, that people have softer bone, and obviously trying to pull out the 600-pound thing can break as well a normal bone, but so you have a problem now, and you and I discussed that you need a surgery.
The nurse, when she got CT scanned, said, "Do not move, stop, just stay right where you are." That's how
bad it was.
scared they were.
So
just so you
we
know.
did the surgery, what now, 3 months, 4 months ago?
Yeah.
Correct?
March 5th.
Now, this is the surgery we did. You had a broken bone here, as you see here.
Yeah.
And we went, instead of in a regular surgery, we would be taking this bone out, put something to expand it, put screws above and below, sometimes even many levels. In a traditional teaching, they say even 3 levels above and below, but if you put something in the front, you can go 2 levels above and below. But everybody who's doing what I do say it is wrong to put only 1 level above and below. You need to go 2 or even 3 level above and below. As a matter of fact, this is just a conversation we have on internet right now. It was some of our colleagues that somebody did 1 level above and below, it failed, and everybody was saying, duh, you should have done that, right?
I would have known that.
And you and I, we talked about that, and I recommended to you, and we applied for that surgery, the way we talked about, going multiple level above and below. So what happened then?
Well, I struggled with insurance accepting it for 10 months.
10 months.
And
so,
we even went to the Attorney General. We tried everything.
But let's start with that. So I saw you, and I scheduled you for the surgery to do it the proper way, and we applied for the surgery, and then insurance came back and said you have to go only 1 level above and below. Is that what they said? Even though I described to them why we are doing that and so on and so forth.
They didn't think it was necessary.
So they wanted me to do what every single of my colleagues says would be more or less malpractice.
Yeah.
So they wanted me to perform
Not fix it.
not properly fix it.
Right.
Because we know now, and we have known that for many long time ago, that you don't, in a situation like that, the reason your bone is broken is soft.
Yeah.
And if you put in a soft bone only 2 screws above and below, it's almost certain that it'll fail.
Right.
So tell me about your odyssey to get it finally approved. What did you have to do to convince this insurance company that we shouldn't do a dumb thing?
How many appeals did we have to do?
We did.
At least 2 or 3 appeals.
We did probably 3 appeals, and then the Attorney General had another company go through all of my medical, and they stated the same thing as well. They agreed with Blue Cross and denied it.
Oh,
So
They were saying there wasn't enough research or new evidence to support that many levels. Is what.
So, and then I guess when it really speeded up, I talked to Dr. Rose, my primary, and she was going to have a talk with you, and I think you possibly helped to get it pushed in, because within a couple days, I heard back and they were like, yeah, we can do this. And I was like, well, what the hell?
so
Sorry, I can't.
No, that's fine. That's fine. No, I guarantee you they did not talk to experienced spine surgeon.
No.
Probably they had some retired foot doctor or somebody else looking at the data.
Exactly.
Oh, yeah.
Because this is in my business is not even a questionable situation.
No.
You never go one level above and below. As a matter of fact, there is right now a LinkedIn post that somebody put somebody else's picture. Look at that. This doctor put only one above, one below, and it failed, and everybody else is smashing that poor doctor. Why would you do one level above and below? We know it's not going to hold. So I can guarantee you, they just repeat the same, not really solidified information that they get from unqualified people,
Right.
and they just confirm themselves. Now, we did the surgery and we did it the way we wanted to do, and how are you now?
I feel much better, much better. The pain is very, very light. Yeah, it's like I'm so glad I did it, and I'm so glad
Okay.
it was done because
That wasn't sustainable.
yes,
Yeah.
yes.
So here, let me turn around. So we put screws obviously above and below. I'm going to go back and forth. The bone is starting to grow. The white piece here is the bone actually growing. And the screws, you have a small pedicle, meaning those areas that the screws have to be put in, they're very, very small, but all the screws are absolutely perfect.
Good.
They're exactly where they are supposed to be. And obviously, that's what's holding you together. And as well, I think the bone growth is so far, for considering this was just 4 months ago, is very good. I'm very happy with the bone growth so far. But just I'm going to ask you, don't do anything excessive until the bone becomes stronger, okay? Well, thank you very much for this. And sorry you had to go through this with the insurance company. And interesting is, this insurance company, they get a so-called second opinion or something, but obviously they get it from the people, unfortunately, that they know they're going to just agree with them and
Right.
rubber stamp it.
Yeah, they're
And
paying.
that's what happened.
Well, and thank you for helping to get it pushed through, and for you did such a great job. And,
Well, thank you very much. I appreciate
I know you're
that.
well renowned, and that's why I came to you.
Thank
so.
you. I appreciate it.